Good evening. This is Dr. Simon Yu. I'm an internist. Today is December 14th, 2021. So I'm going to videotape part 1 out of a 10-part series of my acupuncture meridian assessment training. This will give some basic orientation so they have some idea for what I do. So I do acupuncture meridian assessment, new way of detecting parasite, allergies, and dental problem. My main focus has been evolving around the hidden dental problem, parasite problem, and allergy immune system. That's why I will pick up some hidden environmental toxins, heavy metals, and some other unexpected fungal problems. So here's my book, and I do train twice a year at the end of April and at the end of August of 2022. And so it's divided into parts. It's a part 1, and then I do hands-on training, part 2. This is from the lecture I gave in Germany, in Bavaria, and in Vienna. And part 3, again, hands-on training, especially on hands. And the part 4 will be on training on the foot. And then we have, again, combination of the hands and feet, acupuncture meridian training. And I'll be talking about on part 6, dental related, specifically for dental problem, usually on Saturday. And part 7 will be allergy, immunology, and also I'll be covering some basic understanding of the biophysics. And then I'll review on part 8. In between, we're going to go through some others, again, hands-on training. And number 9, part 9 will be I will use military analysis to explain how to deal with a complex problem. And the part 10 will be ARS Summit in Houston. I did give a lecture a few years ago, and that will be part of the last part of the lectures. So you're going to get part 1 as a part of this overview of what I'm going to do for the next 4 days. Part of the disclaimer, I'm not a trained parasitologist, but I do treat parasites. I'm not a dentist, but I address dental-related medical problems. I'm not an acupuncturist. I have 300 hours in medical acupuncture from Stanford Medical School. I'm not a classic EAB practitioner, but I've been doing over almost 30 years now on acupuncture meridian assessment. I'm a board certified internist, grandfathered in internal medicine, and not recertified. I'm retired from U.S. Army Reserve after 25 years as a full colonel. And I have no financial tie with the EAB acupuncture meridian assessment equipment. This is part of my disclaimer. And also the warning for the rude awakening. Not everybody respond or get well. I'm going to talk about some case studies. Some of them are sometimes they're like hard to believe, but I'll be also talk about some failure also too. And my sense of humor is not for everyone, so you have to put up with me for the next 4 days. And I'm a 3rd degree black belt in Taekwondo, so don't mess around with me. Except I'm an honorary black belt, not true black belt. So when you go through the training, many physicians and dentists have a mental block. So we have to overcome that mental block to really able to read this meridian system. They always worry about medical board, dental board, the fear, insurance, finance, and they all interferes the mental block that cannot make a sense out of it. And ask questions. So 4 days to go through the whole process. And I will evaluate all the attendees so quick point to see whether they have their own problems. And the goal is able to apply next week, able to use parasite medication, and able to detect common dental problems. And so the leading cause of death among healthcare practitioners, the boring PowerPoints, I'm going to try to minimize it, hopefully somewhat entertaining so you can stay awake. And I like to start with this. It's written in 4th century by the sage of calligraphy by Wang Shiji. Now it's a Chinese. I'm not Chinese. I'm Korean. I cannot read Chinese, but what I like in the bottom it says, read me and see we're not so different, you and I. I'm going to train you, but I'm also learning every day. Every time before I do the training, I read the entire textbook in EAB, because I'm always learning every time I go through teaching. So you and I are in the same boat at this point. So curing the incurable by measuring the immeasurable is called part of my Jedi project. And when I check the meridian system, the actual scale is 0 to 600,000 ohms at the acupuncture point. But scale is too big. I simplify the scale from 0 to 100, and normal range from 45 to 55. And the further away from the normal range, you're going to have some physiologic symptoms. So I use the analogy with inspecting the violin and tuning the violin. I started with Dr. Cook. He's a dentist from Wisconsin. I attended his dental conference called Energy Medicine and Dentistry. I was a little bit skeptical when I heard his lecture. I went back again a few months later, and I decided to buy the equipment, and I started using it ever since, almost for the last 30 years. And also the other big important experience has been year 2001. I was as a U.S. Army medical officer. I was in Bolivia. And we have a small medical group, and people line up, and everybody got parasite medication. We have a vet, we have a dentist, and we've been using parasite medication from Bolivia, the cheapest medication available, mebendazole and parental palmoate. So when I came back year 2001, I was already doing EAB, acupuncture meridian assessment. I decided to use some parasite medication I was using in the Army. And that's what have a profound change in the way I practice. So I've been using parasite medications since year 2001, and I will talk about some of the case studies. So now when you get into acupuncture meridian assessment and measuring the meridian system, I like to call this quantum torsion field. We're getting into this invisible field. This invisible to visible, intangible to tangible, inaudible to audible, to figure out what's going on. When people have 20 different complaints, you don't know what to do with these patients. Although lab after lab doesn't really tell you what's going on. So we're going to use ancient matrix system, meridian system to sort things out. This is sort of a typical patient, all the presenting like symptoms, from acne, allergy to all those different problems, panic attack. But she's now in the hospital, and she considers herself as fairly in good health. I think she's something she'll check it. I don't have any really. She marked it as she's still generally in good health. Sort of out of syntax in terms of all those symptoms, she considers herself she's not sick at all. So let's just give you an idea. There's a mismatch in what you're feeling and whether you're really sick or not. So you don't know what you don't know. You have to think differently. And we're going to go through how to map and navigate the acupuncture meridian system. So again, I use this metaphor with inspecting the violin and tuning the violin. Violin have 4 strings. I use 40 main meridian system to find out what the problem might be. So we'll use this as a case study. There's a 40-year-old lady, she's a nurse from Dallas, came to see me with Lyme, chronic fatigue, neuropathy, whole list of symptoms. And this is what I do, measure 40 main meridian system. It says right hand, right foot, left foot. So green means within normal range, within a scale from 0 to 100, 45 to 55 is considered normal range. Blue means it's too low, it's a chronic conditions. Red means inflammation. And this meridian system has been known for thousands of years. So I'm looking for pattern recognition. And this is what I call, based on this meridian system, I did put on triple parasite medication. And she said she was feeling so much better within a few weeks. What she didn't tell me was she had a 5-year-old severely autistic child, and she gave her parasite medication to her son. And within a few weeks, he was able to talk and behaving more and more, becoming normal. And he's considered perfectly normal right now. So I use tuning the violin as a metaphor. And looking for this meridian system. And this is what I call 5,000-year-old new disruptive technology. It's so old, it become actually new. It's not well known. So 40 meridian looking at for the symphony of life. Check for all those individual meridian systems and looking for the pattern recognition. And if you look at from immunology-wise, we're looking at inflammation, infection, and immune dysregulation, and role of chemokines in parasite infections, whether you have ALS, Alzheimer's, asthma, or some pneumonia, seizures, some weird syndrome, all those Th1, Th2, Th17, Treg, all those are tipping in a fine balance. And what is the missing link that we overlook? And the dental play major role, and also parasite play major role that we overlook. It's not part of our training. So we're looking at whether you have a parasite, mold, virus, bacteria, the fine line. People to test this, looking for cytokine and chemokines, but they don't really give you the full picture, the fine balance, which direction they are tipping over. So let's look at from here, the missing link. Think dental. This particular case is an airline female pilot. She have a mixed connective tissue disease. It's like a lupus and rheumatoid arthritis. Her hand is so stiff she cannot bend it anymore, and she cannot fly it anymore. And when I checked, we got the dental x-ray, and she's got all those implant and the root canal. When I saw that, I say, you know, you have to put all your tooth up. There's no other way. And when I tell them, most patients don't come back to see me. And she never came back to see me. But she did see one of the dentists and put all the tooth, and she can fly again. So I only saw once. My recommendation was pull the tooth, now she can fly. She got called mixed connective tissue disease, which is like a lupus and rheumatoid arthritis. Bottom case, she got malignant hypertension, blood pressure 260/160. When I checked, dental is the only one showing up. I was suspecting infection is down here. And it's an oral surgeon through the line, because I sent her immediately as an emergency case. That's through the line. That's where there's an infection of the jawbone is. The very next day, blood pressure came back to 140/85. I did not put on any blood pressure medication. It just blood pressure came back normal after the dental operation. They give you some idea how much dental played a role for what we call unexplainable medical problem. Here's a 72-year-old man from Miami came to see me. His complaint was no energy and delayed ejaculation. That's kind of an odd complaint. People don't come to see me for delayed ejaculation. I thought he should like it, but anyway. His wife is a retired chiropractor. So I'm looking at the pattern. Looking at the pattern there, he's got 19 out of 40 meridian is out of balance. Physical exam, normal. Treatment plan based on acupuncture meridian assessment. Adiprimon, ivermectin. Now everyone knows about ivermectin. Mebendazole, praziquantel, wormwood, followed by antifungal medication, nystatin, fluconazole, and itraconazole for 6 cycles to take. Her cardiac C-reactive protein was over 100, and anything above 3 is considered too high. He's about to have a heart attack any moment. Cancer profile, PHI, is called phosphohexoisomerase at 99.1. Anything above 31 is considered high. It means he's in anabolic metabolism. There's a cancer growing somewhere in his body. I saw him after he took one round of a parasite and fungal medication. When I saw him, all his point was normal. His C-reactive protein was dropped down to 3.73. And his wife knows his chronic coughing spell were gone. He never complained to me chronic cough, because he's so chronic, he never even complained, because he thought that's the way it is. And he's doing much better. And but anyway, just we can turn these people around very quick with a parasite medication. Here's a case with I wrote an article about her. She's called $3 Million Kentucky Woman. She just came back from Mayo Clinic. And she said she was in the Mayo Clinic for 1 month. And she saw the bill. She have a United Health Care. And it cost $3 million of a medical worker with no definite treatment plan or official diagnosis. But she was told she got adrenal burnout, Lyme, seizures, neuropathy, whole list of the problem. So I'm looking for pattern recognition, what the problem is, and then I do some more advanced techniques, look for any hidden problem. She's got parasite problem, dental problem, environmental toxins, and heavy metals. It's an ongoing process after unmasking this problem. If you don't, you can go one doctor after another doctor, one medical institution after another medical institution. You're not going to go anywhere. Here's a 59-year-old man from Arizona with atrial fibrillation, palpitation, congestive heart failure, mercury exposure, parasite problem. And when I check, he have an infection down his jawbone here, down here. He's got 3 root canals. And this cavitation control part of his heart problem, we cleaned them out, and his palpitation and atrial fibrillation went away. His congestive heart failure improved. He's got high mercury, but I wasn't sure whether he got any chelation therapy. And I tried to tell him, get these 3 root canals to be removed. But I could not convince any dentist to remove those perfectly normal-looking root canals. Yes, he's feeling fine. He said, I'm doing fine. He sent me always once a year, send me an email, I'm doing great. And then a few months ago, I got a phone call from his wife that he had an acute heart attack and ended up dying. Now, there's no proof that, I could save him if he removed his root canal. But anyway, this is the kind of stuff. I'm very emphatic to get all the root canal out. And anyway, so that's just another case study here. So in my training, I divide up into medical and dental, but in reality, I don't separate medical and dental. It's a continual spectrum of problems. I don't do classic acupuncture meridian system. I do more what we call modified EAV called acupuncture meridian assessment. Now, I like to use this as a metaphor. There's a book called Warrior's Edge by Vietnam vet Colonel John B. Alexander. He's talking about Jedi Project, disruptive technology, mind control, physical fitness, remote reviewing, subtle energy field, and quantitative EEG neurofeedback. These are the kind of language I use every day. And he's a Vietnam vet training how to survive in business world, but I use this kind of philosophical approach to train the medical doctors. And he says, disbelief is a self-fulfilling prophecy, a prerequisite for failure. I have one physician come to see me for the last 20 years to learn from me, but he's always afraid to apply those. Every reason and excuse. So last time I told him, I don't want you to come to my training anymore. I will let you attend one more time, but if you don't get it, forget it, you have a mental block, you'll never learn after 20 years. And next thing I know, he's been using it. You have to give them the ultimatum. And he talks about, Colonel Alexander talks about correct stance. It's like a how to measure, like a shooting how to shoot gun. Body posture, muscle tone, grip control, breathing, side alignment, trigger pressure. This is the equipment I use. It's called the MORA, the classical EAB equipment I have. I check every patient I see every day, all new patients. And he also talked about to get the point properly, you need to learn how to relax, to visualize, concentration, listen to your inner voice, intuition, big pictures, and talk about, this is a military fellow, talk about quantum mechanics of observation, the difference between patient and the physician interacting. So the training is mainly for basic training, get to the 40 points. For the dentist, I usually focus on 5 points. How to integrate, how to do self-test. And you're going to go into the street fight. When you see patients next day, you're really getting into what I call street fight. You need to figure out what's going on with the patients. And the creating of what we call circle of acupuncture meridian assessment practitioners and networking. And I like to always remind, do no harm. And there's always sometimes incurables. Some of them are too far gone. There's a difference between what we call classical EAB and AMA, the acupuncture meridian assessment. Classical EAB practitioners often check 200, 300 points. And they are mainly based on the homeopathic principle. I mainly check for 40 to 50 points. And I use as an internist, looking at from internal medicine's point of view, looking at things. And also we all look for dental as a probably important underlying problem. We're going to get into all those for next 4 days. So there's a hand point. This is a lymphatic point, dental point, lung, large intestinal meridian, nervous system, circulation, allergy point, cellular organ degeneration point, adrenal, triple warmer, breast point, heart, meridian, and small intestine. For food, over here will be pancreas or spleen, depends on right side or left side, liver, meridian, joint, stomach, connective tissue, skin, fat, gallbladder, kidney, urinary bladder, and the last one will be either prostate or uterus for man and woman. Those 40 points I can check in 10-15 minutes to give you some quick idea what I need to focus on. So there's always a multiple factors, whether you have a Lyme, post-Lyme, or cancers. I always look for infections, parasite, fungi, bacteria, virus, and environmental toxins and heavy metals, and nutritional deficiency, dietary guideline. And I don't dwell too much on genetic tests. I found that genetic testing are not as useful as I thought. But looking at it from cell signaling and others, that's what we're talking about, social status, social interaction, dental, EMF, and toxic emotion. They all interact, affecting the cell, and it will eventually affect metabolic dysfunction, manifest into mitochondrial damage, and will show into the extracellular matrix. That's what I pick up, the signals for the meridian system. So whether you have a Lyme, post-Lyme, chronic disease, and cancer, we can track it through the measuring the meridian system through this extracellular matrix. And this is from looking at from big pictures, looking at the universal ancestors, starting with the RNA and DNA. We have archaea, protozoa as a single cell, bacteria, we have plant, animal, fungi, Homo sapien as a human, and parasite. So I tell my patients, parasites at the top of the food chain, not us. And then fungi is the undertaker. And when you're taking care of parasites and fungi, often bacterial infections, and these RNA, DNA, viral infections often are much easier to control. Even hearing about ivermectin, that's a parasite medication. When you're taking care of that, it often has a antibacterial, antifungal, and antiparasitic activity that seems to respond better. I mean, I never use ivermectin alone. I always use in different combination. So parasite, we have 4 major category of parasite: protozoa, roundworms, tapeworm, flukes. And sometimes people describe the stuff coming out. They describe it's like an alien coming out. And there is a ropeworm by Valinsky, the Russian doctor, talking about this ropeworm, but they are not true worms. They are the probably conglomerate of the dead parasite coming out with the mucus. They call it ropeworm. And there's all those parasite 3 families. We can get into that for next few days. This another one that I was experienced when I was in Bolivia. This is called myase. It's a parasitic infestation of the body of a live mammal by fly larvae, the maggots that grow inside the host while feeding its tissue. As it is as a common horsefly as vector agents for their parasite larvae. It was coming out of their skin. Because when we went through in Bolivia during parasite medication, often they describe the parasite coming out of their skin. And I don't know how many people describing those skin, the parasite crawling under their skin. I have one lady from Chicago area took the picture of the parasite actually coming, and when they hatched, coming out as a fly. And so I call her fly woman. And she also she followed the Shackman's protocol with a fenbendazole, doxycycline, ivermectin. Her primary care physician put on Alini and albendazole, but it still did not fix the problem. When I check, looks perfectly normal, considered within normal range. And then I do what I call enhanced interrogation technique. I put 5 different acupuncture needles in the face, and then hidden problems showing up. So dental problems showing up, nervous system, adrenal, large intestine, lung meridian showing up, and gallbladder meridian. These are all where the parasites are hiding. For this particular patient, prone parental palmoid, niclosamide, praziquantel, and all those natural parasite remedies and antifungal medication. The helminths, this parasite infection induced malignancy. There has been more literature coming out, connection with the parasite and malignancy. And the parasites are what are called masters of deception. Whether in military, we do all those deception. The nature also trying to survive with the deception. It's not easy to detect all those parasites. They're hiding. So I use all the different techniques to unmasking hidden parasite problem. This is one of my articles on medical acupuncture on large intestine. And there's a physician named Van Gelder. He's a Dutch physician. He's considered a medical mystic. He wrote a book called Process of Healing. And in his book, he's talking about Ayurvedic is the origin of the homeopathic remedies. And he talked about divine use homeopathy, for human use herbs, and demonics using drugs. This is from Ayurvedic medicine. And I'm writing about this parasite is like almost like a demonic in characteristic. And drug is like a gift of poison to kill those parasites. And I use massive amounts of parasite medication to get rid of parasites. It's hard to get rid of them. And I don't have a 100% success rate. Here's a paleoparasitology. About 150 years ago, it was very popular, studying mummies. And guess what? All those mummies, they also have a parasite problem and also have a Lyme. So Lyme is not a new problem. This is a Iceman, have a Lyme and parasite problem. We're going to go through this, how to use parasite medications. And one of the most common problem that I'm facing is prescribing parasite medication without the confirmed diagnosis. This is what physicians are afraid to use parasite medication, because we are trained to use confirmed diagnosis to treat. If you don't have any confirmation, either stool test, blood test, nothing shows. So only reason I'm using parasite medication going through the meridian testing. And so there are many questions you're going to have. We have to address them for the next 4 days. And they'll give you each meridian. I've been doing for 20-some years. I know which meridian responds to what kind of parasite medication. So we go through the whole practice. People with a cancer patient, I use all those different combinations of parasite medication, fungal medication, and niclosamide. This is a very important part of it. For dental problem, picking up the cavitation means infection of the jawbone is crucially important. And so we're going to go through the whole process, which medication to use. People are always asking this question. Is there any therapeutic role using parasite? There's a physician named Joel Weinstock on inflammatory bowel disease. He was originally from Iowa, now he's in Boston. Using pig whipworm for irritable bowel syndrome, though he was a moderate success. I've seen many people who didn't respond to it. So parasite might have co-evolved in a way that the parasite actually may help regulate the human immune system to prevent allergies. But we have this parasite problem evolved with us. But the kind of lifestyle we lead, parasite has been kind of evolved into a deeper level, creating thousands different kinds of medical problems. And one of my colleagues, Indian physician, talks about Indians all have a parasite problem, but their diet helped them to check and balance this parasite problem. But when those Indians come to the United States, eating more Americanized food, the parasite become more and more of an obvious problem. So parasites everywhere. I see every 50 states in the United States, they all have a parasite problem. So the definition of parasite, is this possibly symbiont parasitic relationship or not? But most of the time, parasite can play maybe play some important role, but most of the time it's a pathologic problem that we have to get rid of them. This is from a veterinarian magazine talking about, I was mortified. My dog may have a tapeworm, and the dog may be thinking, maybe I got the parasite from her. And in this ad, it says Ivermectin. It says ivermectin, parental palmoid, praziquantel. It's a chewable tablet for tapeworms. I found out much later on, I've been playing this combination. Took me over 10 years to find out ivermectin, parental palmoid, praziquantel works very well for so many different conditions. Only found out the vet already knew it. But I was playing with this back and forth different combination. So sometimes I can save you for 10 years of try and errors by going through this training. So here's a large intestinal meridian. Check all those points. We drill into this small intestinal meridian, liver meridian, gallbladder meridian, the control part of the brain, deep brain. When you have a gallbladder problem, you may have an ankle problem, knee problem, hip problem, a back problem, all kinds of GI problem, but also can have a migraine headache, concentration problem, sleep apnea, mood swing, all those from parasite problem, ringing in the ear, eye problem, just from that one meridian system. Lung meridian. You have a lung problem and from parasite medication and asthma goes away. Heart meridian, bladder meridian, kidney meridian, pericardium, triple one that control your hormonal system, stomach meridian, spleen, pancreas meridian, conception and governing vessel. We're going to go through all those drilling into it. So 90% of the pertinent information comes from patient's history, not from this medical diagnosis with a CPT code. You can have all kinds of a diagnosis, but it doesn't really help you. What's bothering you? And then can I match the problem with the meridian system? And then I investigate the more in depth with the enhanced interrogation technique. So this, what I do for all my patients is, I think it's the last case. Is a physician came to see me, and she's in what we call adrenal burnout, Lyme, breast cancer. I go through all those parasite cleansing, dental work done, the keep showing dental problem. Eventually, there's a perfectly normal looking tooth. And she didn't respond to Lyme treatment, the doxycycline, tinidazole, but keep showing dental problem. And we did special request for dentists to pull the tooth. It's perfectly normal looking tooth. I asked several dentists, they refused to pull it. I found one dentist finally to pull it. And when he saw there are all kinds of microbes, including treponema, they will mimic just like a Lyme, streptococcus, and entamoeba. There's a dental parasite, entamoeba denticola, all kinds of stuff. And also we did a Lyme panel. He's got Borrelia burgdorferi. They're hiding in the tooth. Babesia, Bartonella, Borrelia. They're all hiding in the under the tooth, and perfectly normal looking tooth. And she's finally able to turn around. But just give you some idea how difficult to treat. If you have a dental problem, people just don't respond very well. And this is part of my interest has been so many of these what we call mental problems seems associated with parasite problems. So I wrote an article called Parasite and Mind Control. A lot about anxiety, depression, autistic behavior, obsessive compulsive disorder, and like a bad wedding or schizophrenia. All those things often they have a parasite problem and they respond. This is an article from Science News talking about parasite hijack brain and alter your behavior. This is on Toxoplasma gondii, on subtle human behavior. And for men and women, respond a little bit different. For men, less likely to follow social rules, more suspicious, more prone to jealousy. For women, more warm-hearted, more easygoing, less suspicious, and less prone to jealousy, have a different human behavior. Here's another one here. It says, infectious madness. Talk about catching mental illness from parasite. But I like to also pointing out dental. That's why I was showing the DNA test. We have a dental parasite. You can travel right into your brain. It doesn't take a whole lot to travel to the brain. There's a Dr. Fuller Torrey, he's a psychiatrist, talking about the invisible plague, the rise of mental illness from 1750 to the present, and talking about parasite. This is your brain on parasite. And they talk about how parasite will go to the brain. And so this is one of the slides I was presenting in Vienna in Bavaria. So I was invited to give a talk on parasite, and there's no good way to detect. So how am I going to convince the Germans? They want always the logic. They need the proof to treat parasite problems. So this is one of the slides to convince these physicians in Europe. So based on logic, logical reasoning. Deductive and inductive is one of the classic philosophy, the logic. That's how we develop science, cause and effects. So when you have let's say, eating, as a simple form, let's say you ate rotten meat and you got bellyache, you're thinking it's a bad meat, rotten meat causing my bellyache. That's a normal deduction. And then you have some, let's say, wormwood, that's have a natural antiparasitic activity, and then the bellyache goes away. And you see the connect the dot as like an inductive reasoning. So there's a connection with when I eat some natural herbs, the IBS or parasite, they don't know it was parasite, but maybe my bellyache goes away. So people understand the basic concept. That's what I learned when I was taking a philosophy course 40 years ago in college, or 45 years ago, actually. But there is another type of reasoning. It's called abductive reasoning. It's called AKA inference to the best explanation, in attempt to select some possible postulation that, if true also, can support the conclusion, though not uniquely. This kind of reasoning can be used to develop a hypothesis, which in turn can be tested by additional reasoning or data. This is sort of a kind of a mumbo jumbo, but what they're saying is we can make a hypothesis. So when I came back from Bolivia, I was using for IBS, so patient with a large intestinal meridian, rather than using natural parasite remedies, and there's many people are happy the IBS goes away. I decided to use a parasite medication, mebendazole, parental palmoate. And people come back to see me, they say, oh, my IBS went away. So it's a happy ending. But patients say, by the way, my asthma went away. I didn't see the connection in the beginning. Patient will say, oh, my chronic fatigue, my hip pain, fibromyalgia went away. One young woman recently diagnosed with MS, she will say, oh, my neurologist called me, I don't have a MS anymore. The brain lesion went away. Cancer patients all become stable. I couldn't connect the dot. Only way you can prove is by using what I call abductive reasoning with a possible postulation. That's my way to convince the German medical doctors in Austria, the Vienna, the physicians, how we have to detect, not based on the proof, because there's no good way to detect parasite problem, but we have to use logic. The logic. If you use a parasite medication for the right meridian system, many of those problems will go away. Anyway, also hard sell to convince those of the German medical doctors, but they're all interested in checking on them. And guess what? Most of those German medical doctors all have a parasite problem. In Vienna, most of them also have a parasite problem. But they're treating for asthma, they're treating for chronic fatigue, they're treating for Lyme, and whatever the other problem is. They're missing that boat. And anyway, so these are the most common parasite medication I use. We're going to drill into it. Ivermectin, parental palmoate, tanadazole, alenium, albendazole, praziquantel, levamisole. I cannot get the levamisole anymore. FDA agent came and they removed it from our pharmacy. Niclosamide and all those antifungal medications. These are stuff I use 80% of the time over and over again. So when I approach patient, I use the analogy with tuning the violin for the symphony of life. I can check individual meridian as a solo, as a duet, quartet, and what I call symphony of life. Once you pass that, what I call 45 to 50 outside the range, you're going to have more and more, there are more obvious symptoms you're going to have. One of the hardest part is the dental. Dental can mess the entire system. So if you don't get the dental work done, it's a losing battle. At some point, I tell my patient, I cannot treat you if you don't get the dental work done. So I wrote many articles about that. Toothless in St. Louis. So many people fly in from East Coast, West, they go back home one tooth less. And they feel much happier. Maybe not the way they look, but that's their problem, they have to deal with it. Anyway, so this is just an introductory lecture. So let's try once without the parasite. We have to try. You have to try to use this parasite medication to see how they respond. And part of my job is simplifying so they can use it the Monday. If you cannot do the meridian testing, we have to do muscle test as a means of how to use the parasite medication. So this is my introductory lectures, and we're going to go through 500 more lecture slides to go through the actual practice. So let's just give you an idea what I do, and that this is part 1 out of a 10-part lecture series with a hands-on training. So if you're interested, sign up. We have a training at the end of April and at the end of August every year. Thank you very much.